All right, everybody. Dr. Rayford here from Vet Triage. We are back after a short hiatus. Lots of busy work behind the scenes for Vet Triage, so we are finally releasing more videos. We are continuing where we left off with this June 15, 2015 edition of JAVMA, and we are talking about today pathology in practice. There it is. Pretty gross. These are images of a New Mexico Dahl ram. This is showing here the parietal peritoneal surface of the body wall, which is this one right here, the spleen, and the liver right here. You can see gallbladder there. Hemorrhage or black pigment deposition is found, always black streaks and black dots everywhere. This ram had no clinical signs. It was also hanging out with approximately 170 captive Rocky Mountain elk, Cervus canadensis, and 12 other sheep had died over the past year. This report comes out of the Utah Veterinary School. They found on examination of these organs, numerous flukes were seen in fibrous thickened bile ducts. Flukes have a thin tegument underlain by smooth muscle fibers and a digestive tract known as paired ceca, and lacked a body cavity. So here are the images. Here is a close-up. The top one is pieces of fluke in the biliary tract, and here's a bottom one, microscopic image. So in the top view, we're seeing the liver, flukes known as Fasciola hepatica, displaced from a bile duct onto the capsular surface from the sheep. And then the bottom view, the spleen, capsular hemorrhagic tract filled with hemosiderin-laden macrophages and erythrocytes. The morphologic diagnosis and case summary was extrahepatic fluke attachment sites and intrahepatic migratory tracts consistent with Fasciola hepatica in the rumen, reticulum, omasum, abomasum, liver, lung, heart, kidneys, testes, and spleen. The summary is Distomiasis, which is also known as fascioliasis in a New Mexico Dahl sheep. Just to go over the words here for this bottom picture, this red one of the spleen. They say here hemorrhagic tracts. So tracts typically means that something was burrowing through, so that explains the activity of the flukes. Hemosiderin-laden macrophages and erythrocytes. Hemosiderin is a breakdown product of hemoglobin, which includes iron in it as well. So hemosiderin is one of the breakdown products. Whenever there is damage to organs, you can have hemosiderin develop or accumulate, or if you have red blood cells, erythrocytes that are being destroyed for whatever reason, then also you will see a deposition of hemosiderin. Comments. The speciation of the fluke was based on size, migratory patterns, and intrabiliary location. Temporary attachment sites of migrating flukes account for parietal peritoneal defects and fibrinohemorrhagic tracts in abdominal tissues. Moreover, immature flukes had accessed hepatic veins and subsequently the systemic circulation to lodge in lung lobes with migration through the visceral pleura, pericardium, and myocardium. In cattle, aberrant migration, meaning migration that is not typical of that parasite, is common in the lungs and other unusual body sites. In sheep, fluke infestations in the peritoneum, which is the lining of the abdominal cavity of the abdomen. Lungs, lymph node, uterus, spleen, pancreas, and subcutaneous tissue are described. In sheep, distomiasis is reported to develop primarily during autumn months or early winter. First reported in 1379. The parasite here, Fasciola hepatica, is the major trematode that infects sheep in temperate and subtropical parts of the world. In addition to sheep, the Fasciola hepatica infects goats, cattle, pigs, equids, camelids, rabbits, deer, and otters. Mild winters or increased rainfall is associated with an increased number of cases in many parts of the world. Fascioliasis is described as an emerging zoonotic disease, meaning it can be passed from animals to people. Adult flukes live in bile ducts where they lay as many as 2,500 eggs per day and then excreted in the feces, One animal infected with Fasciola hepatica can shed as many as 3 million eggs per day. Even though greater infectivity is reported in the spring and fall, eggs are laid year-round, and an adult fluke can live as long as 11 years. Eggs develop into myricidia, which penetrate a snail intermediate host, usually Limnaea trunculata. They multiply as sporocysts, radii, and cercarii. They exit the snail. They insist on grass to then become metacaryarii. If these metacaryarii are ingested by grazing animals, they exist in the small intestine, and immature flukes migrate through the bowel wall across the perineum into liver, where they access bile ducts and develop into adults. In sheep, fluke infection results in diminished growth and reproduction rates and poor quality and quantity of fleece and milk, causing major financial loss to the sheep industry. Recommendations to irrigate the sheep pastures differently, reduce the amount of standing water and snail habitat on those pastures, and then administer a flukicide will help in prevention, and that's what they did in this case, and there's been no reported cases in this area since. So yeah, pretty cool report. We don't, as a small animal veterinarian myself, board certified surgeon, I don't hear about this ever, but these are always of interest to veterinarians, especially those who practice mixed animal or production animals. So for the veterinarian, just a reminder of what these flukes can cause, because this sheep had no clinical signs prior to being found dead. And for pet owners, it's very important to talk to veterinarians about what you can do in your area to prevent your production animals from developing probably preventable diseases like this. And if there's a zoonotic component to it, it's very important for veterinarians to educate the animal owners, and it's also important for animal owners to be educated by veterinarians so they know how to deal with these concerns. If you do have animals that just inexplicably die, as an owner of animals, then you really want to get a necropsy. This person waited until a dozen sheep died before they finally reported it. So they put people at risk and other animals at risk of infection by not reporting it. All right, we'll see you guys again in the next video. Take care.